Welcome to the revision of the lower limb. I advise you to listen to the slides carefully and at the end turn the sound off and try to identify the slides by yourself. We are looking at the outer surface of the right hip bone. This is the iliac crest, the anterior superior iliac spine, the anterior inferior iliac spine, the posterior superior iliac spine, and the posterior inferior iliac spine. This is the acetabulum. This is the obturator foramen, the body of pubis, the ischial spine, the greater sciatic notch, and the lesser sciatic notch. Now, from the inner aspect of the right hip bone, the iliac fossa, the pubic arch or the conjoint ischiopubic ramus, the obturator foramen, the pubic tubercle, the pectineal line. This is an anterior view of the right femur. This is the head, the neck, the lesser trochanter, the greater trochanter, the intertrochanteric line, the patellar surface. This is a posterior view of the right femur, the lesser trochanter, the greater trochanter, the intertrochanteric crest, the lateral condyle, the medial condyle, and the intercondylar notch. Regarding the anterior surface of the right tibia, the tibial tuberosity, the shin or the anterior sharp border, the medial malleolus. Now on the back of tibia, this is the intercondylar eminence between the two condyles. This is the groove for semimembranosus below the medial condyle, a facet for the head of fibula, the soleal line. Regarding the skeleton of the foot as seen from the dorsal aspect, this is the talus, the calcaneus, the navicular, the medial cuneiform, the intermediate cuneiform, the lateral cuneiform, the cuboid, the first metatarsal, and this is the fifth metatarsal. This is the great saphenous vein, the femoral vein, the femoral artery, the femoral nerve, the adductor longus, pectineus, the sartorius, rectus femoris, vastus lateralis, vastus medialis. This is the gracilis. This is the gluteus maximus, the piriformis. These are the superior gluteal nerve and vessels, the inferior gluteal nerve and vessels, the sciatic nerve, the posterior cutaneous nerve of the thigh. On the back of the thigh, this is the semitendinosus, the semimembranosus, the long head of biceps femoris, and the short head of biceps femoris. The common peroneal nerve, the tibial nerve, the popliteal vein, and the popliteal artery, which is the deepest structure in the fossa. On the dorsum of the foot, this is the superior extensor retinaculum and the inferior extensor retinaculum. Again, this is the tendon of tibialis anterior, extensor hallucis longus, extensor digitorum longus, and peroneus tertius. This is the dorsalis pedis artery. Notice that it dips in the proximal end of the first interosseous space to reach the sole. In the lateral compartment of the leg, this is the peroneus longus muscle, and this is the peroneus brevis muscle. In the posterior compartment of the leg, this is the gastrocnemius, the plantaris, the soleus. This is the tendocalcaneus. This is the tibialis posterior muscle, and the flexor hallucis longus. This is a back view of the knee joint. From the back, this is the lateral collateral ligament, the medial collateral ligament, the anterior cruciate ligament, the posterior cruciate ligament. This is the lateral meniscus and the medial meniscus. This is the end of the revision. I wish you all good luck.